Something that I've seen, and it's quite a trend with a lot of our patients over here, we see that a lot of patients actually are uncomfortable after they have a heart attack, whether they don't know what their limitations are. We see people all the time with frustrations and anger and whatnot because they don't know what their new normal is supposed to be anymore. But that's what's nice about, cardiac rehab. We're able to get them more comfortable. We get them familiar with their bodies again and back into that groove of things, so that way we can get them up to what they were before. Well, after you've had a heart attack, it's really important, number one, because you are monitored in our program. You wear a telemonitor throughout the entire duration of it. And then from there, we're able to see if you've had any rhythm changes or arrhythmias, as we call them, anything that might kind of set an alarm, I guess, or alert us into notifying your cardiologist and whatnot. Again, we want to make sure that we maintain exercise as we go throughout the recovery process. It'll help them adhere to their medications a little bit better. Not only that, but it sets them up for a positive impact towards behavior change. It's a new lifestyle for them to work towards. Yes, it is safe to exercise after a heart attack. I would, of course, recommend that you speak with your cardiologist, especially knowing when is too soon and when you should get going again. But it is very safe to exercise after a heart attack. The heart is a muscle, and you want to continuously exercise it, and you want it to grow and strengthen again to kind of recover from that new process that has taken over inside of that body. So exercise can be rhythmic movements. Examples of exercise, of course, something that's rhythmic, continuous, organized is another way to describe exercise. But swimming, cycling, running, going to the gym, and weightlifting, those are all examples of exercises that you would do. Whereas physical activity is something that you do about your daily life. Walking to your car and back would be considered physical activity. Not so much of a strenuous activity, but more so just moving the body around and getting it physically active again. After a heart attack, it's important to continue your exercise because it'll help you, whether it's in the long run or the short term. We see it all the time with our patients. They come in here with higher blood pressures, and by the time either they finish their exercise session, that 1 hour, or they're done in their 12 weeks, we see that blood pressure actually start trending downwards all the time. Not only that, but it'll also help with your diabetes. We see blood sugars are being monitored a little bit better. Whenever you finish your exercise, your body releases these hormones called endorphins. Those are going to make you feel a lot better. The hardest part about an exercise is getting to the workout. Once you've completed it, you feel a lot better and you never regret a workout in the end. I always tell our patients that you should speak with your cardiologist no matter what. Your cardiologist is going to know when the best time for you to return to physical exercise would be. No two hearts are the same. People come in with either just one diagnosis, or they come in with multiple diagnoses. And so from there, they should speak with their cardiologist, knowing when is too soon and when they should get active again. After speaking with your cardiologist, it's best that you wait at least 6 weeks. We like to tell our patients 6 weeks after their surgery, especially with the bypass. That way it allows some time for that incision site to heal. You want to avoid any water or hot water exercises. So no going in the swimming pool or anything, but upper body and strenuous activities should be held off at least a little bit longer. It's always best to speak with your cardiologist before exercising though. We always tell our patients in here, you know your body. If at any point when you're working out and you start to feel chest tightness, dizziness, extreme shortness of breath, then that's when you should know that it's time to stop what you're doing and seek medical attention. Talk to your doctor about it, tell your cardiologist. Muscle soreness is very common after the first couple of sessions of exercise, but knowing the difference between muscle soreness and pain is a very important part of it as well. Physical activity, it's recommended that you get at least 30 minutes of exercise at least 5 times per week. But those 30 minutes of exercise don't have to be all at once. You can actually break them up and do them a couple times throughout your day, whether that's a couple of 15-minute walks, maybe get a couple of exercises in between commercial breaks on the TV. But standing up while you're sitting down for long periods of time will actually help you. And then parking a little bit further in the parking lot will also help you get a couple extra steps in too. Cardiac Rehab is a 12-week monitored program. Our patients in here have a telemonitor on them, and that allows us to see if there's any rhythm changes, if we see anything that's abnormal with their heart. But it also allows them a comfortable space to recover. We let them come in here and they work out on the machines for 1 hour, either 2 or 3 times a week, depending on their preference. But within that 1 hour, we allow them to warm up. We allow an exercise session that usually goes on for 30 minutes and then a cool down phase. Within that 1 hour of exercise, our cardiac rehab patients are on the machines for 3 10-minute rounds, and in between each of those 3 10-minute rounds is a set of weighted or banded exercises, which I usually lead the class in.